So we just finished talking about some of the structures within epithelial tissue, and just to review, we have four types of four types of tissues, right? We have epithelial tissue, we have connective tissue, um, muscle tissue, and nervous tissue, and we're still talking about epithelial tissues for right now. So there's different ways to categorize epithelial tissue. One is by the layers. How many layers are there? And a second way of doing it is by the shape of it, like what it looks like. And so this particular slide, we're actually going to be looking at how many layers there are. Okay. So
Ogres have layers.
okay. So the first one is if it's only one single layer of cells, then we call that simple epithelial. Epithelium. There's two ways of saying epithelium or epithelial tissue. They're both the same. So if you say epithelial tissue, the difference is this is an adjective and this is a noun. So if you were to write epithelial, you must write tissues afterward. Okay. Um, and that way you could have basically, you could say either or, epithelial tissue or epithelium. Okay. All right, so let's talk about epithelial tissue. Okay, this is for absorption, secretion, and filtration, and it kind of makes sense, right? If you think about it, is it easier to pass through a single layer of cells or multiple layers of cells? Which one would be easier to pass through?
Single layer.
Yeah, a single layer will be easier, right? Compared to if you have to pass through several layers of cells. And so that's why it is for absorption and secretion. Remember, absorption is to bring things into the cell. Secretion is the reverse, is bringing things out of the cell. Okay. Filtration, we will talk about that in the urinary system, so we will get to there eventually. But basically, it's kind of like if you filter coffee and stuff, so it has to go through a layer or something, and then whatever remains it'll weed out some things, bigger things, and allow the smaller things to pass through. All right. There is a special type of simple epithelial tissue. It's called pseudostratified epithelium. And I don't know if you know what pseudo means. Anybody know what pseudo means? Yeah, false, right? False or fake, right? It means that it looks like it's stratified, but in reality, it's just one layer. So we have an example here on the upper right-hand corner to show you this. If you take a look at this histological slide of the pseudostratified columnar epithelium here, here's one cell over here. Okay, this is the nucleus. The dark staining circular structures are the nuclei. Okay, so that's actually part of the cell. But then you'll notice that this nucleus here is above this nucleus here. So it looks like there's multiple layers, but in actuality, this one, even though the nucleus is higher up, it's just a cell that's kind of squished like this. So it's still touching the basement membrane here. Okay, so that's why it looks like there's multiple layers, but in reality, it's just one single layer of cells kind of thing. So they're all touching the basement membrane. So this is the pseudostratified epithelium. And then when you have more than one layer, okay, so two or more layers, then you have what we call stratified epithelium. Okay. And this is more for protection purposes, right? Which makes sense, right? If you have multiple layers, okay, you can afford to scrape off that first layer because there's other layers beneath it, so to protect the underlying tissues. All right. The next categorization of epithelial tissue is their shape, okay, what they look like. And we want to always look at it on the apical surface. If you remember, what does the apical mean? What does apical mean? It means,
The top surface.
yeah, it means the things on the top. Very good. Okay, so we're going to be looking at those cells on the top surface of the epithelium to see what shape they are. So when we talk about squamous, these are thin and very flat. Okay, the nucleus tends to make the middle portion a little bit bulgy, like a sunny side egg up kind of thing. So if you take a look at it, it kind of bulges a little bit over here, but it kind of thins out on either side. Cuboidal is the next one, and obviously if you think of cuboidal, it looks like a cube, so it looks kind of squarish. So it's as tall as it is wide. The thing about this, it's not perfect. If you look at it under a slide, it's not going to be exactly like a square. It might be slightly taller or slightly wider or a little bit rounder in shape, but in general, it'll have this cuboidal shape. Okay. And then we have columnar. Columnar is a rectangular shape. It means that it's taller than it is wide. And so for this one it will be obvious. It will be a lot taller than it is wide. Okay. And then there's this special type. By the way, the columnar doesn't always happen, but the nucleus tends to be towards the base of the cell. Okay, but it's not always the case scenario. The special case of epithelial tissue when we talk about shape is this transitional. The reason why this is special is because transitional, it is going to be changing its shape. It transitions from one shape to another, and it depends on whether it's stretched or relaxed. When it's stretched out, it flattens up. When it flattens up, it's going to look similar to the squamous epithelium. Okay? But when it's relaxed, it'll have this rounder type of shape. So if we look at this particular histological slide here, and we're looking at this epithelium up here, and we know this is the epithelium, right? Because the epithelium, like we said, functions as something that covers something, right? Or lines something. So over here, there's like this empty space over here, right? There's a space over here. And so this is the tissue that lines whatever organ this is. This is a urinary bladder, by the way. And if you take a look at the surface, remember we got to look at the apical surface, right, on the very top surface of it, and we're going to look at the shape. In this case scenario, the shapes are kind of rounder-ish, right? If you look at this, right, and this is that transitional type of epithelium. So since it's rounder kind of thing, and so this is going to be transitional. So this is when it's in its relaxed form. If it is filled with urine, okay, the urinary bladder, if it's filled with urine, then it starts to stretch out. When it stretches out, it's going to be even flatter than what you see here. It's going to be kind of stretched really thin. For your lab quiz, what I'm going to do is I'm going to be giving you slides when it's most likely it's going to be in its relaxed form. Okay, I'm unlikely going to give you one that's going to be when it's flattened or stretched out, so I don't confuse you between the stratified squamous epithelium versus this transitional epithelium. Okay. All right. So that's with transitional. Okay. So let's go into the specific types of epithelial tissue. Okay. So if we just look at this slide over here, you could notice a few things. First of all, you could see how many layers are there on this tissue here. If you take a look at this, right, these are all the lumen right here, right? This is a lumen here, so on and so forth. So if you take a look at this, how many layers of cells are these? It's just one single layer. Okay, so if we're taking a look at this lumen here and this surface, this is just one layer of cells. If you take a look at the shape of these cells, you could clearly see that they are rather, what kind of shape? What do you think? Yeah, they're going to be rather flat, right? So if you were to um, write this, and my question to you is identify this tissue, you're going to be writing, this is going to be a simple squamous epithelium. And this simple squamous epithelium will be very permeable. Permeable, it allows things to pass through, right? To molecules and gases, which also makes sense too, right? Okay, we already determined that it will be easier for a single cell layer for things to pass through. Out of all the different shapes that we learned, right, whether it's squamous, cuboidal, or columnar, which one would be easiest to pass through between those three shapes? Very good. It would be squamous, right? If you think about it, it's the thinnest of all three shapes. So this will be the easiest out of all the simple epithelium to be able to pass through. So we see this in capillaries. Capillaries are the smallest blood vessels in our bodies. They're only one layer of cells thick, and they're going to have this simple squamous epithelium. We find this in the alveolus, which is in our lungs, okay? And this is a slide of the alveolus. Okay. We find this on serous membranes, and we'll talk about serous membranes later on in the chapter, and also in the glomerulus of the kidney. Okay. All right, so on the lab quiz, I might give you like a picture of this, and I'm going to be asking you, what tissue is this? So you'll be answering simple squamous epithelium. The next question I'm going to be asking is identify an organ for this. And you're going to just put one answer, okay? Just tell me one organ that has this simple squamous epithelium. You could put capillaries, you could put the lungs or alveolus, you could put the serous membranes, you could put the kidneys. The thing about this is that for right now, even though this slide that you see here is actually from the alveolus, eventually you'll know that. Okay, eventually we're going to go into saying like, okay, you must say this is from the lungs, you know, kind of thing. But for right now, since that's going a little bit too far, if you say any one of these, even though this is from the lungs, if you say any one of this, I'll accept it. Okay, you just need to know one example or one organ that has this type of tissue. All right, so the next one here is simple cuboidal epithelium, and you could kind of see that here. Okay, so here's the lumen right over here. Here's the lumen. Okay, right there. And if you take a look at this, I'm going to make it a little bit obvious by just kind of highlighting these cells here. Okay, so I'll color in the lumen now. Oops, I'll color in it. And you could look at it and tell me how many layers of cells are there. Well, it's just one layer, and the one layer just circles around, okay? Just circles around. And by looking at the shape of this, like I said, it's not going to be perfectly, the tallness of it is not going to be as perfect as it is wide, but it's going to be rather similar to each other. So this is a simple cuboidal epithelium. Once again, for absorbing things or to secrete things. And you'll find this in, this is a picture of the kidneys over here. So the renal tubules of the kidneys. You'll find this in ducts. You'll find this in the thyroid. Okay, examples of them. Next is the simple columnar epithelium. And with simple columnar epithelium, once again, it's just one layer thick, right? If you take a look at this, this is just one layer thick. And you can see how much taller it is compared to it being wide. Okay. Once again, because it's simple, it allows things to be absorbed or secreted. The thing about this is that for this particular version of it, you're going to be able to see something called microvilli. Okay, I'm going to erase some of these pen markings here. So if you look at the microvilli are these little structures that you see here. And if you remember from your cell quiz or the cell chapter, the microvilli are just extensions of the plasma membrane to increase the surface area, okay, to allow things to pass in or out of the cell. So that's the microvilli. And this is actually from, I think, the small intestine here. So you'll be able to identify that like that. So if I say ID the organ, you could say small intestine. You could say stomach, okay? And that's what gastrointestinal means. Gastro means stomach, intestinal, the intestines. And be a little bit more specific, right? When you say intestines, can you name the two types of intestines that we have? Name one of the two types of intestine. So yeah, small intestine or large intestine. So you want to be a little bit specific. Don't just say intestines. Say small intestine or large intestine. Very good. Okay. It is found in the uterine tubes. However, they have a different type of structure. It's called cilia on it. And we'll talk about that in just a second. So you don't see this on this particular picture because this is from the small intestine. It doesn't have cilia. And it also has the ciliated structures within the bronchioles as well. By the way, let's see if you remember, or I don't know if you know, these kind of lightly staining parts of it are called goblet cells. And the goblet cells, if you remember, secrete mucin. And when it secretes mucin, it mixes up with water to make mucus. Okay. And that's what this next point here is about. Okay. So over here is the goblet cell, and it secretes mucin. This microvilli that we just talked about, in the small intestine, it's called the brush border as well. And the reason why it's called the brush border, it looks like a brush, small little brush. If I were to redraw this cell here, it's going to look, it's going to look something like this. Okay, so it looks kind of like a brush, and that's why it's called the brush border. Once again, it's to increase the surface area. Increase surface area so that we have more of the absorption or secretion, but in this case it's more for absorption since it's in the small intestine, it's trying to absorb the nutrients. Very good. Okay, so this one we've seen in the last slide, right? The last slide we talked about the pseudostratified columnar epithelium, and this is it here over here. Already you could tell what are these cells over here that I'm trying to color in that are lightly staining. These are the ones that produce mucin. Yeah, these are the goblet cells. Yeah, you can see that there. Okay, good. This is pseudostratified once again because it looks like there's multiple layers due to the nuclei over here. Looks like there's multiple layers, but in actuality, they all connect to the basement membrane here. So there's only one layer. And it's columnar because it's taller than it is wide. And so this is for protection-ish purposes because even though it's one layer, they kind of fold upon each other a little bit to help with protection a little bit. But once again, for absorption and secretions. This one's called ciliated pseudostratified columnar because it has these structures here called cilia. You might be wondering, well, doesn't that kind of look like the microvilli that you have here? I would say yes and no. Okay, if you look at the cilia here, compared to the microvilli, which one's longer? Which one's longer and which one's going to be shorter? The one that's longer, it's going to be the cilia. okay, which makes sense, right? The cilia, what's the function of cilia? Cilia is going to be providing movement on the surface to move things across it, okay? It's going to move, like in this case, the mucus. As it moves the mucus, it's going to move it to our pharynx, which is our throat area, so we could cough up the mucus or to swallow the mucus. While the microvilli, we could barely see the individual like extensions off the plasma membrane, right? So this is going to be to increase surface area. So the functions are different, so the structures are also different. All right, so this is the ciliated pseudostratified columnar epithelium. And then the next question will be identify an organ that has this. And this is from the respiratory tract here. So you could say the trachea, you could say the bronchi. They will have these type of tissues.
Hey, Professor, since both the simple squamous and cuboidal, since they're both in the kidney, for the lab quiz, do we have to specify where, or could we just...
No. So that's the advantage, I guess, in this case scenario for you. You could say it's for kidneys for both of them. And I'll totally accept that answer. Later on, when we get into the urinary system, now at that point in time, I need you to distinguish what's the difference between the two. Okay?
Okay, thank you.
Yeah. For right now, since you don't know all the organs, or no, sorry, you don't know all the structures within the organs, that's okay if you could just name the organ that has it. All right, so cross out those things. All right, so let's look at stratified epithelial tissue now. Okay, so this is when we have multiple layers. For this one, we could clearly see that it's multiple layers, right? Look how many layers there are. You know, like all the way from here, 1, 2, 3, I don't know. There's a lot, okay? I don't want to count them all. But there's a lot of layers here, more than one. And it's squamous. And remember, where are we looking at when we say it's squamous? Because to me, I don't know about you, but does this look squamous? No, this doesn't look squamous. So where are we supposed to look at if we're looking at the shape of these epithelial tissues? Yeah, we want to be looking at the apical portions of it, the top layers, right? And if you look at the top layers, yes, these cells here are going to be kind of flat, right? And that tells you that's squamous. Okay, so first thing is to determine how many layers are there. In this case scenario, it's going to be stratified. And then we're going to look at what is the shape of these cells on the top layers, and it's going to be squamous. Okay, good. Like we said before, when you have these stratified type of epithelial tissue, they're for protection purposes. So to protect us from, in this case, friction, and also pathogens. Pathogens prevents like bacteria from coming in or virus from coming in. So it helps us have this barrier against them. And then on the basal portion of it, the basal, if you remember, is on the base, right? So these cells here on the base, they will undergo mitosis to kind of replenish these cells here, because we're going to be rubbing against stuff and whatnot. So these cells are going to end up dying or getting scraped off. So we got to replenish that. And so how do we do that? We have the stem cells on the base to undergo mitosis to replenish that. All right, so there's different types of stratified squamous epithelium. One is keratinized stratified squamous epithelium. Keratinized means that it's going to have this protein called keratin inside of them. So keratin is going to make it waterproof, it's going to make it tougher, so it's going to make it stronger. But the downside of that is that it's going to end up causing these cells to also die off in the process of it, okay, as it goes further and further away from the connective tissue. So they will end up dying. If it dies, if it dies, then we're not going to be able to see the cell in its entirety, meaning that we won't see the nuclei of those cells. So let me tell you about this. Like if you take a look at this, do we see the nuclei of the cells here? Do we see these nuclei here? Remember, nuclei are the darker staining circular in this case, oval structures, right? We do see it there. So in this case scenario, this is a non-keratinized stratified squamous epithelium. But if we take a look at this tissue over here, if you take a look at the very top, do we see those nuclei anymore on this particular tissue here? Now we don't see those like dark staining circular or oval type of structures here. So in this case scenario, this is the keratinized. Remember, these are the dead cells that are on the surface. Okay. So in this case scenario, it's going to be found in skin. And we'll talk more about this in the next chapter. The non-keratinized ones, like we said over here, they don't have keratin. And if they don't have keratin, they're going to be remaining alive. And we could see the nucleus here, as we kind of shown earlier. And we'll find this in the oral cavity, the esophagus, the vagina, and the anus. Okay. So you might be thinking, okay, it makes sense that since we have skin, it's to protect us from abrasion or friction and stuff like that. But why would we need to protect us from friction or abrasion in the oral cavity or the esophagus? What might cause those abrasions or friction to occur in your oral cavity? Yeah, it's going to be the food that you eat, right? I'm sure all of us have eaten like potato chips or Captain Crunch or something like that. It scrapes your mouth and it's whatnot type of thing. It helps protect against that scraping of it because food is rather dry, and so it's going to cause abrasions and stuff. Same thing within the esophagus. For the vagina, it's for sexual intercourse, right? To have that barrier protection through abrasions, and also not only through sexual intercourse, but also for childbirth as well. And for the anus, you may not know, but as we're digesting things in the body, we're going to be absorbing a lot of water back into our body. In the small intestine, we're going to be absorbing water, and then whatever remaining water, the large intestine will also absorb it. So it's going to cause the feces to be rather dry at that point in time. And when it's dry, it's going to cause a lot of friction as well. Okay. So that's the reason why it's on the anus as well. Okay, so let's take a look at the next type of tissue here. This is the stratified cuboidal epithelium. If we look at the stratified cuboidal epithelium, here's the lumen, right? And if you take a look at this is, can you tell me how many layers is this actually? By just looking at it, how many layers is this particular tissue? Yeah, it's just 2 layers, right? And if you take a look on the very top surface of this particular structure, you can see kind of it's as tall as is wide kind of thing. So that's why it's this stratified cuboidal epithelium. And for this stratified cuboidal epithelium, it will form the walls of certain types of ducts. Some of them will be able to produce hormones and sperm for protection. And here we find it in the sweat glands, the ovarian follicles, the seminiferous tubules of the testes. So if you say the ovaries, the testis, sweat glands, that's fine. Okay. By the way, just to let you know, when testes is plural, testis is singular. Alright, this next one you don't need to know, and that's why it's grayed out. If you have trouble seeing the grayed out, it's optional. You don't even need to know it, but if you have trouble seeing it, I do have the darkened version of it if you want it, so let me know. For the stratified columnar epithelium, if you take a look at it, there's multiple layers here. Okay, more or less this is like 2, maybe 3 layers. Okay, but once again, you're looking at the top layer, and you can see that the top layer is kind of this columnar shape. Okay. For this, you find it in the male urethra and the ducts of the salivary glands. You don't need to know this because one is to kind of prevent you from getting confused from other types of tissue, but the other thing is that it's pretty rare finding this in our body. Okay. And then we have this transitional epithelium, which we kind of talked about earlier. Notice that even though this is a stratified epithelial tissue, the name doesn't have the word stratified inside of it. Okay, so it's implied that it is stratified. So on the exam, don't put the word stratified inside of it. It's just transitional epithelium. So with the transitional epithelium, once again, we could see that it's multiple layers, right? It is stratified, right? And we're going to be looking at the top layers here, and you'll notice that the top layer isn't really one of the categories we just talked about. It's not really flat. It's not really cuboidal. It's definitely not columnar. So it's kind of this rounder in shape. Remember, if it's rounder in shape, this is in its relaxed form, where there is nothing filling it, stretching it, causing it to become flat. And most likely, I'm not going to give you a slide that shows that it's flat, right? So it's going to be this rounder type of shape. So this is once again for protection. All the stratified are for protection in general, having multiple layers. In this case scenario, it's to protect us from the urine in our urinary bladder. Okay, and once again, it's transitional because it does change shape. When it's relaxed, it's going to look like this. When it's filled up and distended or stretched, it's going to be flatter. Sometimes it's binucleated. Bi meaning that there are two. Nucleated because there's two nuclei, and you can see that right here. It doesn't always occur, but you do see it every so often. So that may give you another clue as to what type of tissue this is. Alright. So where would we find this? We'll find it in the urinary bladder. It fills up with urine. In the ureter, which also has urine passing through it. And also the proximal urethra. You may not know what proximal means, but you will know it in this unit and hopefully for the rest of the semester. Proximal means it's closer to the body. Okay. So it means just the beginning portion of the urethra. Alright, so that's the types of tissues. So this next is going to be this question here. Let's see if you could go ahead and go to that Socrative. I don't know if you remember. Let me go back to that page so you could get to it. But the Socrative website here. I haven't released it yet, so don't quite answer it yet. But I'm going to be releasing it to you in just a second. Maybe just put that in there, so if you want to click on it, you could. And we'll try to answer this question here once I get the Socrative thing up. Alright, it should be up now, so go ahead and make your best answer from it. And we'll see what you get. Okay, so if you take a look at this particular tissue here, first off, we know that it's an epithelial tissue because it's on the very surface, right, of something. So over here, if you take a look at the top here, this is the space, right? In this case, it's not a lumen because we know we will know which organ it is. But let's just take a look at this. First of all, is it simple? Just by looking at it, is it going to be simple? It can't be, right? Because it's definitely more than one cell layer thick, right? Okay, so it's definitely not simple. So we can cross those out, right? It's not simple. Is it pseudostratified? Well, no. I mean, pseudostratified may look like it's stratified, but it's not. But this is not that pseudostratified, so it's not going to be that. Transitional, remember transitional, if we're looking at the top cells, right, it'll be kind of rounder. Sometimes they're binucleated, so it's not going to be that. But let's kind of just look at the other reasonings behind this. Okay, first off, let's take a look at the shapes, right? What's the shape like on the very surface of this? And if you take a look at these shapes here, they're going to be rather flat, right? They're really flat over here. So we know it's squamous, right? The next question is like, okay, are these cells on the very top living or dead? Okay. Yeah, so the very, it's not simple because there's so many layers, right? Simple is just one layer. Okay. So are these cells on the very top side of it living or dead? Do you see the nuclei up there on the top? Any nuclei that you could see? Yeah, it's pretty dead, right? Yeah, you see nuclei, but the nuclei are all the way down here, right, and lower. So the top layers here are dead, no nuclei, so it's going to be keratinized, right? The dead ones are the keratinized ones. Good. All right, so let's take a look now. We're done with epithelial tissue. Let's take a look now at connective tissue. So here are some characteristics of connective tissue. One is that unlike when we look at epithelial tissue, there is a lot of cells. There's a little bit of extracellular matrix. In this case scenario, depending on what type of connective tissue we're looking at, but generally speaking, there's going to be a lot more extracellular matrix. If you remember extracellular matrix, this is the stuff outside of the cell, whether it's the fluid or structures outside of the cells. So fewer cells and more space. Okay, once again, I should have just put next point here. Extracellular matrix is the fluid, which are also called the ground substance, and also the structures that we're talking about are the fibers. Okay. The ground substance could be a fluid. It really depends on what type of connection tissue we're looking at. It could be a fluid-like, it could be gel-like, it could be viscous, it could be even solid as well. Okay. And this ground substance is made by these cells called the fibroblasts. The fibroblasts also make up these protein fibers as well, and there's different types of protein fibers that we will need to know, and we'll describe them as we're going. Connective tissue is made from mesenchyme. This is the embryonic form of the connective tissue. Okay. So all the connective tissue comes from this type of mesenchyme tissue. So let's take a look at some of these functions now. Like the name implies, it's connective tissue, right? If it's connective tissue, it's going to end up binding the organs together. It's going to connect the organs together. Here's one example, the tendons. The tendons are these cord-like structures that's going to bind a muscle to a bone. So here's a tendon here. Okay. Here's kind of another tendon. Here's another tendon. Connects muscles to bone. There's another structure that's going to connect bone to bone, and it's called a ligament. So this is a ligament that combines this bone to this bone over here. Okay. And we're going to learn about these tendons and ligaments in the next unit. Another is for support as well. So with connective tissue, it's going to help support these different structures of our body, whether it's the nose, our ears, or even our trachea. The reason why it's important to end up having support for the trachea is to keep the airway open at all times so that we could keep on breathing. It's also for protection as well. Okay, bones, they protect organs. Fats, they protect the organs as well as a cushion. Also as a way to store energy as well. Okay. Another is for immune purposes. Some of our tissue, especially where we're talking about blood, will have leukocytes. Leukocytes is another fancy word for white blood cells. And that's going to help protect us from pathogens, from being invaded by other organisms. And also, it does provide movement purposes. Muscles tend to provide movement more so than the connective tissue, but we need something connecting the muscles to our bones, right? Like the tendons to provide movement. And there's also cartilages that will help with that purposes as well. And we'll talk more about that in the next unit. And then there's storages too. Okay, so when we look at storage, we're looking at mostly regarding to fat as a way to store energy. But not only that, our bones, they store calcium and also phosphorus. And we'll learn more about that in the next unit as well, a little bit in this one. And we have blood for transport. The blood transport gases, it transport nutrients, it transport waste, and so it brings things throughout the body. So all these are different functions of the connective tissue. This next slide talks about the cells that we're going to be encountering when we talk about connective tissue. First one is the fibroblast. We already mentioned fibroblast as to what it does, right? It's going to make the ground substance, the potentially fluid type of things surrounding the cells, and it's going to make those protein fibers that we were talking about. Some of these fibroblasts are going to be transformed into what we call fibrocytes. The word cytes here means cells. Okay. And these fibrocytes, they lose the function of making ground substance. They lose the function of making protein fibers. However, they still help maintain and repair the extracellular matrix. There are also macrophages as well. And these macrophages, they are coming from these cells called the monocytes, okay? And their function is to help phagocytize. So you might not know phagocytosis, but phagocytosis, what that means is that the cell, site, right, site, is going to be eating. What does it, quote unquote, eat? It doesn't really eat it. It just takes in dead or damaged cells and takes in like bacteria or other type of invaders kind of thing. Then there's something called mast cells. Okay, mast cells, they're mobile type of cells. And they're part of our immune system by secreting some heparin. And heparin is going to prevent blood from clotting. If you prevent blood from clotting, it's going to allow more blood to get to this area. It's going to also release histamine to help dilate the blood vessels. What do you think will happen when you dilate the blood vessels? Is there going to be more or less blood flow as you dilate blood vessels? If it dilate, oh, by the way, dilate means it's going to expand. It's going to make it bigger, basically. So it's going to move more blood to this area. And the reason why we want to move more blood to this area is to help out in fighting against infections. Okay, good. So the next cell is the leukocytes. And we said leukocytes are also known as the white blood cells. And there's many different types of white blood cells. We'll get to them when we get to the cardiovascular chapter. But all this is part of helping us with our immune system as well to protect us from pathogens. And then we have the adipocytes. The adipocytes are the fat cells. And we mentioned about fat cells before. They store up these molecules called triglycerides. And what triglycerides is fat. Okay. And why do we have this? It's to store it up so we can have a source of energy in case we're starving or don't have enough glucose in our body. However, because it's so filled up with this triglyceride, it's going to press the nucleus towards the side of the cell. So it's going to store up so much triglyceride that we have the nucleus being only on the very edge of the cell. So there's all this triglyceride within the cell itself. So those are the cells within the connective tissue. Let's talk about now the fibers of connective tissue. So these fibers, once again, are made by the fibroblasts. We have the collagen fibers. And collagen fibers tends to be really thick. Usually when we dye them, it's going to be rather lighter in color. So these thicker structures here are the collagen fibers. And the collagen fibers are really strong, and they prevent stretch resistance, prevent it from being stretched, sorry. Elastic fibers, on the other hand, tends to be thinner, than the collagen fibers. And like the name implies, it has elasticity. If you think of a rubber band, right? A rubber band gets stretched, and after it gets stretched, when you let it go, it recoils back to its normal shape. So that's elastic fiber. By the way, collagen fibers is made by collagen protein, which makes sense, right? While elastic fibers is being made by elastin. Yeah. Then we have something even thinner called the reticular fibers. So even thinner are the reticular fibers. And reticular fibers are there to resist forces as well and support the organ structurally. It's also made of collagen fibers as well. Collagen protein. The thing about this is that it is branched as well. Okay, when I say branched, it means that it will end up forming these jaggedy angles. And we'll see these when we look at the reticular connective tissue. So let's take a look at the different types of connective tissue. Okay. So they are organized by the type of ground substance that they have. Okay. When we say viscous, I don't know, do you remember what the word viscous means? Anybody remember what the word viscous means? Kind of like when we talk about honey and molasses. Yeah, what's up? Yeah, it's thicker. Sorry, I didn't hear you. It means that it's thicker. Very good. So if it has a thicker ground substance, then we call this connective tissue proper. And there's two types of connective tissue proper. There's a loose kind and a dense kind. The loose kind means that there is more ground substance than there are fibers and cells. And the dense one, it's going to be densely covered with more fibers and cells, but less ground substance. When we look at cartilages, then we have a semi-solid ground substance. So even thicker, even more solid than the connective tissue proper. And then we talk about osseous tissue, bone tissue, now we have a solid ground substance. There is one more type of connective tissue, which is blood. And blood is going to be a liquid type of ground substance, which I think most of us already know. Okay. So let's take a look at the loose connective tissue. Okay, this is part of connective tissue proper, right? So loose connective tissue has a lot of ground substance, not that many fibers and cells. Areolar connective tissue, like the one that's shown over here, will have some collagen, it has some elastic fibers, and it has fibroblasts. Remember, the fibroblast makes this ground substance. It makes the fibers here. And the function of this is to help with cushioning and also preventing damage whenever we're moving. However, it is also highly vascularized. If you remember vascularization, that means that there is a lot of blood going to this place, right? Because of the blood vessels here. So we have blood going to this place to provide nutrients and to remove the waste. So a lot of the epithelial tissue will have this areolar connective tissue right next to it. When we take a look at this slide over here, this in reality doesn't really look like this. What I mean by that, doesn't really look like this, is because what we see here is a smear. When we look at this, this is a smear, meaning that if we were to take a slice of areolar connective tissue, it won't look like this unless we smear it against the microscope slide. Once we smear it against the microscope slide, now we could see the different fibers and these cells and stuff like that. Okay? All right, so when we look at this picture here, we're going to be looking at collagen fibers. And you can see the collagen fibers over here. Okay, remember the collagen fibers, we said it's going to be thicker, and it's also going to be lighter staining. So we said it's thicker and lighter staining. Okay, so you can see this. Here's a collagen fiber right here. Here's another one going up and down. Okay, so this is the collagen fibers. Okay. The thinner ones are the elastic fibers. So these thinner ones are elastic fibers. So they're thin and they are darker staining if you take a look at this. Okay. Those are the elastic fibers. And then you see the nuclei, right? Do you see the nuclei here? The nuclei are the nuclei of the fibroblasts. Okay. So these are the nuclei that you see of the fibroblasts. There are reticular fibers, however, they don't stain well in this particular stain, and so you don't see them, although they are there. Ileana, I'll go ahead and go to the last slide here so you could take a look.
Thank you so much.
But we'll be going, it's going to be repeated later on. That's kind of like an overview of this slide, but yeah. Always ask if you want to go back. I don't mind doing that. All right, so next is where will we find this? Okay, so not only do you need to identify it, you got to identify an organ from it. So over here it says it's underneath most of the epithelial tissue. So as long as you know where the epithelial tissues are found, most likely there's going to be this areolar connective tissue as well. So name one of the epithelial tissues that we've learned. Someone name one of them. Okay, simple squamous epithelium. Okay, yeah. Okay, with simple squamous epithelium, can you name an organ that has simple squamous epithelium? Yeah, the lungs is good, right? From the alveolus, very good. Kidney is a good one too, right? Not really the trachea in this case scenario, but it will come up later on when we look at the other different types of tissue. Capillaries is a great one. So when we talk about like capillaries, yes, it has this simple squamous epithelium, and right underneath that simple squamous epithelium, we'll have this areolar connective tissue as well. So all these most likely will have areolar connective tissue next to them. If we talk about simple cuboidal epithelium, it's also in the kidneys, so we're going to also have tissue, this areolar connective tissue as well. Okay. So that's areolar connective tissue. So you just need to name one organ as long as there's epithelial tissue that surrounding that organ, most likely they're going to have this areolar connective tissue next to it. Okay, so the next one here is reticular connective tissue. Okay, so reticular connective tissue here has, instead of the collagen fibers and the elastic fibers that are very visible, in this case we're going to have the reticular fibers being more visible. We still have fibroblasts to make this, but at the same time, we'll have a lot of leukocytes. Okay. Leukocytes, once again, are the white blood cells. And what we see here are going to be the nuclei of both white blood cells and also fibroblasts. But since it's going to be hard to distinguish one from the other, we're going to just assume that all these are going to be white blood cells. Okay, so these are, if you're going to identify these, we're going to just say they're white blood cells. Okay. So we'll find this in the spleen, in the thymus, in the lymph nodes, and also in the bone marrow. A lot of these are lymphatic organs here. Okay. And once again, we'll see these leukocytes here. We'll see these reticular fibers. Remember, how do we know that these are reticular fibers when we look at them? Right? Yeah. When we look at it, notice what's happening here. How do we know that these are reticular fibers here? By just looking at this. How do we know this is reticular fibers? We said that they tend to be, yes, branched, right? Very good. So when you see this branchiness, you should be thinking reticular fibers. It is, in this kind of case scenario, because we're so zoomed in, it does look a little bit thicker, but it tends to be the thinnest of all the different fibers, but we have no other reference points to determine that they are very thin. Okay. And then the third type of loose connective tissue is this adipose connective tissue. Okay. And its function is to help cushion, insulate, and also for energy storage as triglycerides. And we find this around different organs. So on the exam, if I'm asking identify an organ that has adipose connective tissue, just say around an organ. So when you say around the heart, great. Around the kidneys, awesome. But if you just put kidneys themselves, then I'm going to mark it incorrect because it's not on within the kidneys per se. It's going to be around it for the most part. And it's also going to be in the subcutaneous layer of the skin. What I mean by that is when we say subcutaneous, it means underneath. Okay, so it's going to be underneath the skin. And we'll talk more about that in the next chapter. These cells that we see here, we said earlier on, are the adipocytes. And you can see that the nucleus are kind of squeezed on the periphery, on the sides of it. Because it's so filled up with the triglycerides inside of it here. And this is specifically for white fat for energy storage, but there is something called brown fat as well. And brown fat are found mostly in infants, and it's not for energy storage per se, but more for heat production, to make more heat for them, because they lose a lot of heat because of their huge heads. Alright, so the next type of connective tissue is dense. Okay. When we look at dense connective tissue, it's dense because there's a lot more fibers compared to the ground substance. Okay, so a lot of fibers, not that much ground substance. While in the loose one, we said that there's a lot more ground substance, not that many fibers. So dense regular connective tissue is going to be this one here. And you'll notice there's a lot of these collagen fibers, and they're all kind of parallel with each other. That makes it very strong to resist stress in one direction. But if you were to apply stress in a different direction, then it may not be as strong anymore. So when we're talking about examples of this is the tendons and ligaments. So you've heard of the ACL, right? Anterior cruciate ligament. And someone will tear that. And the reason why it may tear is because it may have been an injury due to some pressure that occurred in a different angle than where it's supposed to be at. So it tears that ligament there. So once again, we see all these collagen fibers that are parallel with each other. But you also see these nuclei. And these nuclei are the nuclei of the fibroblasts. We have also dense irregular connective tissue. For dense irregular connective tissue, now we have collagen fibers going in. Are they parallel with each other in this case scenario? No longer the case. It's going in very many different directions. And pros and cons for this. The pro part of it is, since it's going in all different directions, it makes it stronger in all different directions. The con part of it, it isn't as tough. It's not as strong as if they were all going in the same direction. So where would we find this? We'll find it in the skin, the dermis of the skin. Okay, we'll talk about the dermis, what that is later on in the next chapter. It's going to be around cartilage and bone as well. Okay, and then you find this in the kidney and spleen as well. So we find these collagen fibers, and once again you see these nuclei, right? And the nuclei are the nuclei of the fibroblasts once again. Next one here is the elastic connective tissue, and they do have collagen. Okay, don't get me wrong, there is collagen in here, but because of the elastic fibers being stained so darkly, it's going to be hard to distinguish the collagen fibers. So we're going to ignore the collagen fibers when we're identifying it. We're going to just be paying attention to these elastic fibers here. The elastic fibers are a lot more darker staining, they're a lot thinner and stuff like that. And with these elastic fibers, we'll find this in the arteries. We find it in the vocal cords. We find it in the suspensory ligament of the penis, and also in the spinal column as well. Okay. The reason why we find this in the arteries is because the heart is a pumping mechanism, right? Whenever the heart beats and contracts, it's going to push blood out. If it pushes blood out, the arteries will expand by filling with blood. If you remember, what does elastic fibers do? Right? After it expands, what's going to happen to those elastic fibers? It's going to recoil back. Exactly. So the heart is not always pumping blood out, right? There are times where the heart is going to relax. If the heart relaxes, blood is not being pumped out anymore. So what's going to push blood and maintain that blood pressure? Well, it's due to the arteries recoiling back to its normal shape to push the blood further. Okay, so that's the arteries there. Okay. So we find this in collagen. We do find collagen fibers in here, but once again, because of how many elastic fibers there are, we're not going to be able to label it. We're going to just label these dark staining structures here as the elastic fibers. Okay. There are fibroblasts, but because of these dark staining elastic fibers, it's going to be hard to distinguish the actual nuclei of the fibroblast itself. All right, so that was the connective tissue proper. Remember, the ground substance for the connective tissue proper was that it's viscous. The next one here is going to be gel-like ground substance. So it's going to be a little bit more sturdier than being just viscous. It's even more solid now. And instead of having fibroblasts and fibrocytes, we're going to have these chondrocytes instead. And the chondrocytes are going to reside in these spaces called lacuna. So this is going to be a space. In this one, you could kind of see a little space over here on the side over here. You see the chondrocyte over here. Whenever you look at the word chondro, it means cartilage. And remember, what does cyte mean again? What does the word cyte mean? Yeah, cytes means cell. Very good. So this is a cartilage cell. Once again, it's stronger and more resilient because it has a ground substance that is more solid now. However, due to it being more solid, it is avascular as well. Okay. Not only is it avascular means there's no blood here, there's no blood vessels going to here. It needs nutrients nearby. Since it's a gel-like ground substance, let's think about this. Do things move easier or harder through something that's liquid, through something that's viscous, something that's more gel-like? Which one is going to be having things harder to move through? Yeah. Things that are more viscous is going to be harder. And then if you get to gel-like, it's going to be even more solid, right? So it's going to be even harder to move through something that's solid, right? So that's why whenever we injure ourselves and we end up causing the cartilage to be damaged, it's going to take a long time for it to end up healing. Okay, let's take a look at this first example here. Is the chondroblast. So remember, we were talking about fibroblasts and all the other connective tissue earlier on. So with the chondroblast, on the other hand, it replaces that. So instead of having it secreting those ground substance and protein fibers, it's the chondroblast that's going to secrete this gel-like matrix. And the interesting thing about the chondroblast, like the fibroblast, right? Fibroblast ends up converting into the fibrocytes. In this case, the chondroblast is going to convert into the chondrocytes. It does this when it ends up being trapped in that lacuna. The lacuna, once again, is the space around the cell, and the cell itself inside is the chondrocytes. Alright, let's take a look at the different cartilage types now. The most common in our body is the hyaline cartilage. And when we look at hyaline cartilage, it is the weakest. The reason why it's the weakest is because the collagen fibers, there are collagen fibers, but they're very, very thin. They're so thin that, can you see any collagen fibers in here? If you take a look at it, do you see any collagen fibers by just looking at it like this? No, right? There are collagen fibers in there, but they're so thin that we don't actually see it in this histological slide of it. Okay, and the function of it is to provide support, to also be flexible, at the same time being resilient. So where will we find this? We'll find it in the fetal skeleton. So when we're developing, we're going to be made up of a lot of its collagen. As we're growing and we're growing taller, the bones on the long bones will have this hyaline cartilage as well. We find this in our nose and also around the trachea to keep the airway open at all times. Most of our larynx is going to be made of this hyaline cartilage, and then we have something called costal cartilage. Costal means the ribs, okay? But be careful, because the ribs themselves, are they cartilage, made out of cartilage? Are ribs made out of cartilage? No, they're made out of osseous tissue or bones, right? It is a bone. So these costal cartilage are going to attach the ribs to your sternum. The next type of cartilage is fibrocartilage. And it's called fibrocartilage because it has these collagen fibers. Now we can actually see these collagen fibers. Look at the collagen fibers here, right? We see the collagen fibers. More or less, they're going to be parallel with each other in this case, so it makes it very durable and resistant to shock in that direction here. Once again, you do see the chondrocytes, right? And you also see a little bit of a space around it as well. What is that space called again around the chondrocytes? Yeah, the lacunae, right? Lacunae is plural, lacuna is singular. Very good. Where will we find this? In the intervertebral disc. The word inter means between. You may have heard of that prefix before. International flights, right? It is a flight that is in between nations, right? So intervertebral discs, these are these discs that occur between the vertebra. We also have the pubic symphysis. The pubic symphysis is the structure that will connect on the anterior or the front portion of the pelvic bones. We'll take a look at that when we get into the unit 2. And we also have the meniscus of the knee, which is found in the knee joint as well. We'll take a look at this later on the next unit as well. Once again, you can obviously see the collagen fibers, and you can see the chondrocytes as well as the lacuna. All right, let's take a look at this next type of cartilage here. This next type of cartilage, once again, you see a space around it, right, which is the lacuna, and you see the cell within the space, which is the chondrocyte. However, you'll notice that the fibers on the outside here, they're a lot thinner and a lot darker staining, and they're going in kind of all different directions. So these are the elastic cartilage with elastic fibers here. So it helps be resilient and flexible at the same time. And since it has that elastic fibers, it allows it to recoil back to its normal shape and size. So if you take a look at where it's found in the external ear. And when we talk about the external ear, this is the ear, so you can play around with your ears, right? And once you play around with it and you let go, they return back to its normal shape and size. Is also found in the epiglottis. The epiglottis is the structure, as we swallow food or liquids, it's the structure that's going to flap downwards. And when it flaps downwards, it prevents food or liquids from going into our larynx. It prevents food and liquid from going into our trachea, basically. Okay. All right, so these are the 3 different types of cartilage that you'll need to know here. Okay, so this slide here, don't worry about it. This is more of a FYI type of thing. Okay, so when we talk about vitamin C, we need vitamin C to develop our collagen fibers properly. If we don't have enough vitamin C, our collagen fibers don't develop properly, and we're going to end up preventing our wounds from being healed, or it'll prevent, it'll cause our teeth to kind of fall out and things like that. That's what sailors in the back in the day, when they didn't have enough citrus or vitamin C in their diet, will end up getting something called scurvy, right? So after they started introducing vitamin C in their diet, using citrus fruits and stuff, they stopped having that scurvy. All right, so that was cartilage. Now let's go into osseous tissue. Osseous tissue is even more solid. This is actually a solid ground substance now. And this solid ground substance is made because of the inorganic components to it, which is calcium phosphate. When you look at the word inorganic, that means that it doesn't have carbon. Give that with a little bit of salt with that, because the reason why I say that is because there are some molecules that do have carbon that's still considered inorganic. Things like carbon dioxide or carbon monoxide has carbon inside of it, but they're still considered inorganic. But in this case, calcium phosphate doesn't have any calcium inside of it. Don't get confused with these collagen fibers. Collagen fibers are made out of carbon. Okay, they are organic components to it. But the inorganic ones are going to cause it to be very strong and very solid. Okay, so because of that, it helps us with support, protection, and also storage of these calcium phosphorus. Right? We talked about earlier bones being a storage for this calcium and phosphorus. So if our body doesn't have enough calcium, it's going to get it from our bones. However, the downside of it getting from our bones, it's going to cause it to become weaker. Okay. So this is osseous tissue. Don't need to know whether this is a compact or spongy bone. We will learn about that in that next unit. But technically speaking, this is a compact bone over here. So how do we identify this is osseous tissue? Well, we'll look at these structures. These are called osteons. And the osteons, they have these ring-like structures here, and these are the lamellae. We'll talk about that eventually, but it looks like a tree trunk, right? If you were to slice a tree trunk, it has these rings as well. And not only that, you'll be able to see these spaces. If you look at the spaces, they're named exactly the same as the cartilage spaces. Okay, so these spaces here are called lacuna. You don't see the cells that reside in the lacuna here, but if you were to have a cell inside of here, remember, what are those cells called in the cartilage inside the lacuna? What are those cells called? Yeah, chondrocytes, right? In this case scenario, they're not called chondrocytes because chondro means cartilage. In this case scenario, they're going to be called osteocytes, okay, for bone cells. Okay. So here is osseous tissue. Okay, my next question will be identify an organ that has this osseous tissue. So don't say bone. Okay, I want to actually have you name a bone. So go ahead in chat, name a particular bone. Yeah, you could say the femur, that would be great. You could say the skull, that's awesome. Tibia, great. Radius, awesome. Fibula, make sure you use fibula. Scapula is fine. Yeah, all those are good. Okay, good. So make sure on the, when it says ID in organ for this one, name a bone. Okay, don't just say the word bone. All right, we're at the last of the connective tissue. And when we look at blood, the ground substance of blood is a fluid. Okay, and this is going to be a fluid with cells. And the cells and also the fragments of cells are going to be called the formed elements. And their function is to transport things like nutrient, waste, and gases. You don't need to know these terms here, but let me show you what each of these cells that you have here are These are called erythrocytes. And the function of the erythrocyte is to carry oxygen. Okay, that's the main function of it. It does carry carbon dioxide, but not that much of it. Most of the carbon dioxide is going to be transported within the plasma or the fluid in the blood. And then we have these other cells. Okay, they all have their different names to it. We'll learn them later on, but these are called leukocytes in general, the white blood cells, and it's for our immunity. These fragmented cells are called platelets, okay, also known as thrombocyte. I don't like the word thrombocyte as much because these are not actual cells anymore. They're pieces of cells. Okay. And then we have plasma. The plasma is just the fluid that is surrounding the cell here. That's going to be the plasma, the ground substance. And that's going to be where it transports the majority of the things. All right, so the next question is ID an organ that has blood in it. Technically speaking, yes, blood is in a lot of different organs, but let's actually name the organs that actually has the, let me put it in this way. Let's talk about the organs that mainly contain blood inside of them. Yes, the heart would be a great one. What other? Not really the brain, although there is blood going to the brain, right? But it's not really. We do have blood going to the lungs as well. Let's think of what do you call those things that transport blood in? Yeah, blood vessels, arteries, veins are going to be awesome answers to this. So for this one, let's be a little bit more specific. Let's say the heart. Let's say the artery or vein. Or you could say blood vessels too. That's fine with me. Okay. What's the smallest of all the blood vessels? Yes, capillaries. Very good. All these are going to be awesome answers. Okay. We'll try to keep it in the cardiovascular system. All right. So this next slide here are going to be talking about membranes. And when we talk about membranes, a lot of them are going to have this combination of both epithelial tissue and connective tissue, which kind of makes sense, right? When we talk about epithelial tissue, they are avascular. And since they are avascular, they need to have a source of nutrients and to also get rid of its waste. And because of that, it needs the connective tissue next to it. So all these membranes here, well, not all of them, but the majority of these membranes will have this dual nature of both having the epithelial tissue and also connective tissue. Okay, so we're going to be looking at these. The first one here is the cutaneous membrane, and cutaneous means the skin. So we're going to be able to see this cutaneous membrane on the skin itself. And the skin's cutaneous membrane is to prevent water loss and also preventing things from entering our body. So you should be able to tell me by now, what is the tissue that makes up our skin? That's one of the layers of our skin. The dermis is one of the layers of our skin. Yeah, it's the epithelial tissue. Very good. Let's be a little bit more specific. What type of epithelial tissue covers our skin? Yeah, it's on the epidermis. You're very great. That's good. It's the keratinized what? Keratinized? Squamous is great. Okay. Keratinized, stratified squamous epithelium. Very good. So you'll need to write all those words out on the lab quiz itself. So make sure you're constantly spelling and spell checking yourself to make sure you do it correctly. Very good. So we have the keratinized stratified squamous epithelium. And underneath that, we're going to have what type of tissue right underneath it. Remember how I said most of the times, most epithelial tissue will have what kind of connective tissue right underneath it? There will be fat underneath the skin, but what type of connective tissue will be right underneath most epithelial tissue? Epithelial tissue is avascular, so it needs something that is vascularized. It is areolar connective tissue. Okay. The basement membrane, it's going to connect the epithelial tissue to the areolar connective tissue. So that's in between the two tissues right there. So the areolar connective tissue is going to be right underneath the keratinized stratified connective tissue. And then underneath that areolar connective tissue, we'll later learn there is this dense irregular connective tissue as well. Okay. We'll learn this later on in today's lecture as well. So that's the cutaneous membrane on our skin. Then we have something called the mucous membrane. It's also called the mucosa. It's called the mucosa because it's going to produce mucus. Okay, it's going to produce mucin, which mixes up with water, making mucus. So where do we find this? We find it in our digestive tract, respiratory tract, urinary tract, and also the reproductive tract as well. And its function is to protect us and also to help with absorption and secretion. So the reason why I don't specify which type of epithelium this has is because it depends on which organ we're looking at. If it's the small intestine, it's going to be the simple columnar epithelium. If it's the esophagus, it's going to be this non-keratinized stratified squamous epithelium. If it's the trachea, it's going to be the pseudo-stratified columnar epithelium with cilia, so on and so forth. So it really depends on which one we're talking about. But many of these epithelium will have goblet cells. And do you remember, what does goblet cells make? They're going to secrete what? We're going to have a break right after this slide here. What does the goblet cells make?
Mucin.
It makes mucin. And mucin, when it mixes up with water, becomes mucus. Very good. And underneath this epithelium, right, we just said that most of the times areolar connective tissue is going to be associated with it. So it's going to have areolar connective tissue underneath it. And that is called the lamina propria. And underneath this here is going to be a smooth muscle layer called the muscularis mucosae. Muscularis because it's made out of muscles, the smooth muscle. Mucosae because it's part of the mucosa. The next one here is called the serous membrane. And the serous membrane is also known as the serosa. And the serous membrane, they're going to line the viscera. Viscera is the internal organs that we have. And it lines the walls of our cavity as well. Okay, so if you think about it, you could think about the lungs, okay? So the lungs, the outer surface of the lungs, it's going to be made out of the serous membrane. And then the walls are surrounding the lungs, behind the ribs, right? Behind the muscles between the ribs and stuff is going to be lined with also this serosa as well. And the reason why it lines this is because these serosa is going to be making this fluid as well. So whenever the lungs rub against the rib cage, it prevents friction from occurring. The serous membrane is made of a simple squamous epithelium. And like we said, there's going to be areolar connective tissue right underneath the epithelium. And this is specialized because it has this fluid. And the fluid helps prevent that friction from occurring. There are certain types of occurrences where the fluid is no longer there. If the fluid is no longer there, then the lungs is going to be rubbing right against the ribs and the muscles there, and it's going to cause friction. So it's going to be very painful whenever you take any breathing. Lastly, we have the synovial membrane. And synovial membrane is unique because it doesn't have the epithelial tissue. It just has connective tissue in here, both areolar and adipose. It still makes a fluid like the serous membranes, but it's called the synovial fluid. And the fluid here, once again, is to prevent friction from occurring within joints to help with lubrication, basically. So what I want you to get out of this is not only to know that epithelial tissue is always with areolar connective tissue, but also to know that most of our membranes has both of these types of tissue, both epithelial tissue and also connective tissue. What's the last word? Adhered for. Are you talking about the serous fluid here? Made by serous membrane to prevent friction for membranes to adhere together, I think, is what I meant to put. All right, why don't we take a little, let's take a 5 to 10 minute break, and so let's get back together before 1 o'clock. Okay. I'll take this slide and move it. Yeah, prevent it from adhering to one another. Okay, I'll take a little break and we'll be right back. All right, so we finished talking about epithelial tissue, and we just finished talking about connective tissue. Now let's look at the third type of tissues that you need to know, muscle tissue. And with muscle tissue, there's 3 types, and the main function of muscles is to contract. And when it contracts, it's going to provide movement, and the way it does this is that it is capable to be excited. When I say excited, it means that generally speaking, a cell, inside the cell is going to have a negative charge, and outside of the cell is going to be a slight positive charge. However, when it gets excited, usually a neuron communicates with that muscle cell. And when it communicates with that muscle cell, it's going to cause the negative charge inside the cell to become positive. Once it becomes positive, we call that being excited. This membrane potential that we're talking about just basically means that when it's the difference of that charge between the inside and outside of the cell, having the inside of the cell slightly negative and outside of the cell slightly positive. And when it switches, when the inside becomes positive, and that's going to cause it to be excited. Okay. So its function is to contract. There's 3 types. We have skeletal muscle, like the name implies, skeletal because these are the muscles that's going to attach to the skeleton. And these are going to be voluntary muscles. Voluntary is when we're consciously controlling these. So we could voluntarily control these muscles. So if I tell you to flex your biceps brachii, then you're able to flex it, kind of thing. So this is something that we have control over. It is multinucleated and also striated as well. Okay, multinucleated meaning that there's multiple nuclei. Okay, so multi meaning many, right? And if you take a look at it, there is a lot of nuclei in this one cell there. Okay. While you're developing, they used to be different cells, but they end up fusing into this one very elongated cell. Not only that, you see these cells, right? And they're all kind of parallel with each other. Not only are they parallel, but you also see these striations as well. And striations mean stripes, basically. And so this is formed because of the proteins inside of them. And you'll later learn about this when we get into that unit. That forms these striations. So not only do you need to recognize that this is skeletal muscle, but my next question would be identify an organ that has this skeletal muscle. Can you name one muscle in your body? Very good. Okay, so some people put biceps, some people put triceps, quadriceps. I noticed that everybody who's putting it on here right now, since spelling does count, what I need you to do is to put an S at the end of biceps and triceps and quadriceps. The reason why is because the word bi is 2, right? Ceps means head. And so there's actually two of them kind of thing. So it is one muscle, but it has two heads to that muscle. Or triceps has three heads to the muscle. So make sure you have the S at the end of biceps and triceps and quadriceps. Yeah, you could say deltoid, you could say gluteus maximus. If you, yeah, so any of those will be fine. Okay. Technically speaking, when we get into the muscle chapter, I'm going to have you say even more properly. So you're going to end up saying biceps brachii. But for right now, since we haven't gotten into that chapter, if you just put biceps, I'm totally fine with that. Okay. All right. So the next muscle here is the cardiac muscle. And just by the name itself, you already know which organ has this, right? Cardiac meaning the... Which organ? Heart. Yeah. This is the heart. Very good. This is an involuntary muscle, meaning that we have unconscious control of this. Okay, so meaning that we cannot control this. Yes, you could kind of slow down your heart a little bit, but that's an indirect way of slowing it down through biofeedback. But you can't tell your heart to just stop, right? Kind of thing. It won't just stop when you tell it to. So this is an involuntary muscle. And these cells here are branched. When I say branched, you could see how this one cell over here, this is one cell here, and notice how when it connects to this cell here and connects to this cell. So they end up branching, like one cell connecting to two cells and so on and so forth. Okay. They are still striated like the skeletal muscle, and they are mostly mononucleated. Okay, every so often, like this one, are binucleated. Okay, but most of the time there's only one nucleus inside of it. They do have these structures here. Notice that these darker staining structures, these are the intercalated discs. And if we went back to the beginning of this chapter, we talked about gap junctions. And so this is a gap junction that allows communication between one cardiac muscle cell to the next one. So when it contracts, all of them will be able to contract at the same time. So we find this in the heart. Here's the next one. It's the smooth muscle. And with the smooth muscle here, these are also involuntary muscles, like the cardiac muscle in that aspect. But unlike the cardiac and skeletal muscle, this does not have any striations. And that's why it's called smooth muscle. Okay? And if you look at it, there's no striations here. Okay? They do have a fusiform shape. Fusiform meaning that it has this shape here. Meaning that at the ends tend to be thinner than the middle portion of it. Where will we find this? We find it in the GI tract. GI is gastrointestinal, so you could say stomach, you could say small intestine. The respiratory tract, so the trachea, the bronchi, the bronchioles. Urinary tracts, you could say urinary bladder, the ureters, things like that. Blood vessels, yeah. And we said viscera as well. So most of the internal organs will have this smooth muscle. Okay. Now to the last of the tissues, nervous tissue. Similar to the muscle tissues, they also can be excited as well. Remember, inside the cell tends to be negative in the outside, and then when it gets excited, it becomes positive on the inside. Their function is to communicate. So it communicates one cell to another. And they do so using electrical signals. And that electrical signal is by transmitting that positivity. Once it becomes excited, it transmits that positive across the cell itself. And also chemical signals. And we'll later learn that these chemical signals are called neurotransmitters. And where will we find nervous tissue? We'll find it in the brain, we'll find it in the spinal cord, we'll find it in the nerves, and also this structure called the ganglia. We'll talk about these ganglia later, but these are cell bodies within the PNS, okay? Peripheral nervous system. We'll get to that. We do see here, on this picture here, the neurons. And the neurons are these these cells that you see here. They have these structures that come off of it called dendrites, and an axon that comes off of it as well. But all these nuclei that you see here, all these small little cells that you see here, are called neuroglia or glial cells. These help support the neurons here. All right. So let's go ahead and let me reset the Socrative. Oops. Go ahead and reset this here. And let's see if you could answer this quick question. I don't know if I still have it. The Socrative pasted on here. Once again, oops, did not mean to. Once again, that's the room. Let's see if we can identify. Notice I used the exact same picture here, but now I am pointing to somewhere else on the picture. So I want you to identify what type of connective tissue this is. Well, first of all, we know this is a connective tissue because it's not on the surface of something, right? So it's deeper in, so it's a connective tissue. Now you have to kind of think about it and think, what kind of connective tissue is this down here, though? So some things in your head should be thinking, you know, what kind of fibers do I see? Do I see any type of cells, you know, or nuclei inside of here? If it's the fibers, you know, what kind of fiber is it? So on and so forth. That should be going in your head. Okay, a lot of A's, some D's and E's. Kind of not sure, it seems. Okay, so let's kind of go over this and figure this out here. Okay, so if you take a look at this down here, what kind of fibers are these structures here? Anybody know? Are they, remember there's 3 types of fibers that we needed to know. Are they the collagen fibers? Are they the elastic fibers? Or are they reticular fibers? By looking at this. Okay. Remember, the collagen fibers are going to be thicker and lighter staining. Elastic fibers are going to be thinner and darker staining. Reticular fiber also thin and darker staining, but the difference between elastic and reticular is that the reticular is going to be very branched, right? So looking at this, yeah, a lot of you are choosing collagen fibers, and you're correct. These are collagen fibers. Awesome. And remember how we said that depending on which tissue they are, some of them will be parallel with each other, right? If you look at this, are they parallel with each other? No, they kind of go in all different directions, right? Good, okay. Here's another clue. It's like, what are these cells then next to it? What are these, the nuclei that we see here? What are these cells here? Yeah, those are the fibroblasts, okay? They're not chondrocytes because chondrocytes, if you remember, will have a little, they're kind of rounder in shape, right? These are just the nucleus. They'll be rounder in shape for the chondroblast, and there's a lacuna around the chondroblast as well. So let's kind of look at some of these things, okay? So looking at this, it can't be a cartilage because we said that it doesn't have a chondrocyte inside it, the lacuna. It's not going to be adipose connective tissue because adipose connective tissue will be this rounder kind of cell, right, with the nucleus on the side. So it can't be that. Okay, dense regular connective tissue. If it's dense regular connective tissue, the collagen fibers should be parallel with each other, so it can't be that. If it's areolar connective tissue, we usually will also find elastic fibers as well, which we don't see here. So we're going to cross that one out. So this is the dense irregular connective tissue with the collagen fibers going in every single, every which way direction. So this is going to be the dense connective tissue. So the follow-up question is, where do we find this dense irregular connective tissue? But well, we mentioned this earlier on, right? If you take a look at this, what was this tissue called again up here? What was this tissue here on the top called? Yeah, it has keratin inside. Keratinized stratified squamous epithelium. Very good. And which organ do we say that that's from? Very good. It's from the skin. Okay, so meaning that this dense irregular connective tissue is also found in the skin as well, because this is all part of the skin here. Okay, so let's see. Okay, this is going to be a little bit trickier question. Using this exact same picture here, if I were to label it over here, and I say identify this type of tissue here, this is going to be, the reason why I say it's trickier is because we actually haven't seen this tissue look like this before. Okay, so with this particular tissue that we see here, you want to think about what kind of tissue might this be. Remember, here are some of the clues, right? You notice how this tissue is right underneath the epithelial tissue. If it's right underneath the epithelial tissue, what tissue is usually associated with epithelial tissue that's right underneath it? Now, this is areolar connective tissue. Very good. This is areolar connective tissue. Remember how come this doesn't look like the same as the areolar connective tissue that we saw on the slide earlier? Well, that's because remember that slide that we looked at it is going to be a smear, right? We take this over here and we smear it across the microscope slide, and then we look at it under a microscope and it makes it look like that under certain types of dyes and stuff. Okay, so Jasmine was asking whether dense irregular connective tissue is only found in the skin. No, it's not only found in the skin. That is one example because we looked at this already. But you could also find it around basically the outer parts of the liver and kidney and spleen and things like that. Okay. All right, so let's go ahead and look into the next chapter. We're going to go into the integumentary system next. The integumentary system is going to be talking about the skin, hair, so on and so forth. So let's go on to there. Okay, so like I said, it's going to be made out of the skin. And we said earlier on the skin has a cutaneous membrane. And let's see if you remember. The cutaneous membrane has what kind of tissues with it? What kind of tissues does the cutaneous membrane contain? Well, what's the very outer part of the skin made out of? What kind of tissue is the outer part of the skin? We just mentioned it, right? No? Okay. It has the keratinized, stratified, squamous epithelium. Okay. It also has what right underneath it? What's going to be right underneath the epithelium? Yeah, what kind of connective tissue would be underneath it? Yeah, it would be areolar. Very good. And there's one more. We just mentioned it. What was that other tissue underneath the areolar connective tissue from that last slide that we just answered? Yeah, it was dense irregular connective tissue. Very good. Okay. So all this is going to be making up this cutaneous membrane here. Here are all the other accessory organs regarding to the integumentary system, whether it's hairs, nails, and also these glands that we'll be talking about. Okay, the skin is the largest organ in our body. They have two layers to it. It has the epidermis, like we said, made of this keratinized stratified squamous epithelium, and a dermis, which consists of both the areolar connective tissue and also the dense irregular connective tissue. There is something, oh, by the way, if you dissect these words, right, epi means on the surface or on top, okay? And there is another layer called the hypodermis, but the hypodermis is subcutaneous, meaning it's underneath the skin. Okay, it's not part of the skin, it's underneath the skin. And it's going to be made up of mostly of the areolar connective tissue. Two types of skin. There's thick skin and thin skin. Thick skin is only found on the palms of your hands, soles of your feet, your fingers, your toes, and all these will have sweat glands because we have sweaty hands and whatnot too, and whatnot. But it doesn't have hair follicles. Does not have hair follicles. With thin skin, on the other hand, they do have hair follicles. They have something called sebaceous glands as well. Okay, we'll talk about sebaceous glands later. Of course, they have sweat glands too. Okay. And we'll talk about the differences between thick and thin skin in a little bit too. Okay, some functions of skin. We said that it's for protection. And protection is because they have this protein called keratin. The keratin helps prevent water loss, makes it stronger, and this helps also prevent infection and blocking out pathogens too. So it provides a barrier, like we said earlier on, keratin helps prevent water loss. And melanin is there to help protect our nucleus from being damaged by the UV radiation. So people that have a lot more sun exposure will be darker skin because of the melanin to help protect the DNA in the nucleus. And it also prevents chemicals and microbes from entering our body. It is also selectively permeable, meaning that only certain things are allowed into the skin, not other things. Since cells have a plasma membrane around it, and plasma membranes are made out of phospholipids, things that are lipid-based are going to be more easily absorbable than other types of drugs. So things like the nicotine patch can be absorbed through the skin. Another function of the skin is to make vitamin D. It does not make vitamin D directly. Okay, it's only the beginning stages of vitamin D that it starts it off. And then it gives the byproducts of what it started off to the liver to continue on with the process, eventually to the kidney, and then that's where it actually makes vitamin D. It also has a lot of nerve endings to it, and so we have these things called thermal receptors. Thermal meaning for temperature. And mechanoreceptors. Mechanoreceptors allows it to be able to detect things like touch, pressure, and things like that. Things that changes the form of that receptor will be detected by this. And nociceptors, on the other hand, this is to detect pain. It helps us with thermal regulation. Thermal, once again, meaning temperature. So it regulates the temperature. How does it regulate the temperature? Well, it will help with vasoconstriction and vasodilation of the skin. Okay, so if you vasoconstrict, right, the blood vessel becomes smaller. If the blood vessel becomes smaller, there's going to be more or less blood flow to the skin. If there's vasoconstriction, it'll be less blood flow. If there's less blood flow to the skin, then we keep more of the blood in the core of the body. If we keep the core of the blood if we keep the blood in the core of the body, then we will lose less heat. Okay, so when we're cold, we're going to vasoconstrict the skin. Versus when we're hot, we want to vasodilate the skin so that more blood flow goes to there, so we can dissipate the heat from our core to the extremities of our bodies to release the heat. As well as the skin will allow us to sweat, and what sweat does, it's going to allow us to cause the sweat to evaporate. And when the sweat evaporates, then it's going to cause cooling effects. So it's going to decrease the temperature. Yeah, so the mechanoreceptors, they're going to detect things like touch, pressure, probably itch, and things like that. Things that's going to cause when the skin ends up moving or changing its shape, that's what's going to be detected. Excretion. So sweat will excrete not a lot, but some urea. Urea is a nitrogenous waste, is a waste product. Most of the urea is going to be released as urine, and so we're going to release urea through our urine for the most part. And it's also for nonverbal communication. Okay, it provides different types of facial expressions. The skin does. Also using like our eyebrows as well. However, it also helps us with social acceptance as well. What I mean by social acceptance is that, you know, if you don't have quote unquote normal skin, unfortunately, like people don't accept them as much, right? They won't be as socially accepted, even though they might have a nice personality and whatnot type of thing. It is something that does cause this social acceptance to occur by having skin on us. All right, let's take a look at some of these cells on the epidermis. One of these keratinocytes. The keratinocytes, they make keratin. Keratin makes it waterproof and makes it a lot stronger. But we talked about this, right? How this keratin, because it's a lot stronger, it's going to be harder to absorb nutrients and whatnot, so it ends up dying off. So the living keratinocytes are going to be found in the first three stratas. The strata we'll later learn are the layers of the skin. And the last two layers, if it's the thick skin, will be dead. Melanocytes, on the other hand, are these cells that's going to make melanin. And melanin, like we said earlier on, it's going to help protect us, protect the nucleus from UV radiation. However, this melanin is going to be phagocytized by the keratinocytes. So people who have darker colored skin could be because there's a lot more melanin being produced, or it could be because the keratinocytes ends up not phagocytizing as much. So it's a combination of the two. When we have someone with freckles, that's because of the melanin accumulating there. And freckles occurs usually because of sun exposure, and it's going to accumulate more melanin at those locations. Similar as a mole as well, but the difference is that a mole isn't because of sunlight. It just develops, whether through genetics or whatnot, accumulates and ends up causing the melanocytes to form into a different type of cell, accumulating more melanin at that location. For dendritic cells, these are macrophages as well. And they are going to protect us against pathogens by taking in up those bacteria, and helps alert our immune system. And then there's something called tactile cells. And the tactile cells, they help detect the sense of touch. There are other structures that detect touch as well, but this is just one of the many types. So don't worry about identifying the different types of cells, because I'm not going to give you a picture here to identify them. But most of these are going to be the keratinocytes that have keratin inside of them. But you do see all the different types of cells labeled here. Okay, so we talked about the strata, right? We said that the first 3 layers on the bottom are going to be living keratinocytes, and the last 2, if it's a thick type of skin, are going to be dead. Okay, so the very first layer here are going to be kind of cuboidal and stuff, and they will undergo mitosis. They have the stem cells that undergo mitosis, so that it replaces the dead and dying cells as it progresses upwards. It also has the melanocytes to produce melanin, and tactile cells to have that sense of touch. And that's we find all these cells in the strata basale. Like the name implies, it's on the base, right? If you look at the base of it, it's going to end up causing us to, here's the stratum basale right here. Let me just color it in for you. Okay, that's the stratum basale. The next few layers here is called the stratum spinosum. And the stratum spinosum is going to have multiple layers of these keratinocytes. Okay, they're still undergoing mitosis and dividing, so all this here is going to be the stratum spinosum now. And then we have a single layer right on top of that called the stratum granulosum. The stratum granulosum right over here are still living cells, and we could see that they're living cells because we still see the nuclei right over here. So we know that's still living cells because of the nuclei there. Okay. And this is where they start to die off. Okay, so they start to die off at this location, which also you could see, right? Everything else beyond this point are going to be dead cells because we don't see any more nuclei. This next layer is only found in thick skin. It's called stratum lucidum. Lucidum means lucid, meaning that we could see through it. This particular dye prevents us from seeing through it, but it's this darker orangey color here. That's the stratum lucidum right there. Yeah. We only find this in thick skin. It's not found in thin skin. All the rest of the layers here of skin is going to be the stratum corneum. Of course, thick skin will have a lot more layers than thin skin. There is a mnemonic for this to remember the layers of the epidermis, and it goes like this, okay? So we'll start from the top downwards, okay? It's come, let's get sun burned, okay? C for corneum, L for lucidum, G for granulosum, S for spinosum, B for basale. Okay. All right. Now let's go deeper in and look at the dermis. Okay. The epidermis was on the top, and it's the keratinized stratified squamous epithelium. As we go deeper in, now we have the connective tissue. It's highly vascularized, which makes sense because it needs to provide nutrients for the epidermis. And it contains some glands, some nerve endings, and hair follicles. The very first layer here on top is the papillary layer. And this papillary layer, you should be able to tell me what kind of tissue is in this papillary layer now that we kind of looked at this picture earlier on. It's right underneath the epithelial tissue, right? What is the connective tissue that's right underneath the epithelial tissue, providing nutrients for it and whatnot? Yeah, it's the areolar connective tissue. Very good. Okay, so that's going to be found in the papillary layer here. And then deeper in, we have the, oops, sorry. Okay, before I go any further, I forgot to mention that in the papillary layer, there are these structures called the Meissner's corpuscles. Okay, oops. Yeah, that's a Meissner corpuscle. That's sense of touch. Okay, it gives us the sense of touch. The Meissner corpuscles are also called the tactile corpuscle. So if someone's like lightly tapping on you, this is where it's going to be detecting that tapping. It's the opposite. Okay, that's not a dumb question. So the stratum cornea is the very top. The strata basale will be on the very bottom. You could think of it like this, or remember it like this. The word basale means on the base, right? So it should be on the bottom. There's going to be a lot of capillaries in this location. Okay, so for nutrients and waste. So this next layer underneath the papillary layer is the reticular layer. And the reticular layer, like we said earlier on, has this dense, irregular connective tissue. Yeah, the mnemonic is going in the opposite direction. You're absolutely right. Okay, so the reticular layer has this dense, irregular connective tissue. And in here we find hair follicles. It extends from the papillary layer down to here. Also other glands here as well as blood vessels. Alright, so this slide, don't worry about it too much. This is more just for FYI type of information. Whenever we get calluses, this is due to the amount of friction that occurs, constant friction that occurs, and basically it's accumulation of dead cells at that location. When we talk about blister, on the other hand, this is when the epidermis separates from the dermis. So the epithelium separates from the connective tissue. Do you happen to remember what are those structures that connects the epithelial cells to the basement membrane? Anybody remember what are those structures that connect them? They're part of the cell junctions, one of the cell junctions that we saw mentioned earlier. Anybody remember? Not lipids. There are cell junctions. The cell junctions, there's 3 types that we needed to know. There was a gap junction. There were the tight junctions. There were the desmosomes. Which one helps with connection so that things don't get ripped apart, basically? The tight junctions will prevent things from passing between cells. So yes, it's the desmosomes. They're kind of like the Velcro of things. So in this case scenario, because we rubbed against something really hard, it destroyed the connection. It destroyed the desmosome, or technically the hemidesmosome in this case, causing fluid to build up in between. Alright, so this next slide here, I'm covering it up for now, but for those of you who might be squeamish, I'm going to be showing you a bed sore, so it might not look pleasing to you. So if you want to look away, you could look away for a second, and I'll tell you when to look back at it. But this is a bed sore, okay? And what a bed sore is when you apply a lot of pressure at a location and you don't move it. And what ends up happening is that pressure is going to prevent blood flow in that location. And because it prevents blood flow in that location, then that tissue will start to die off. And when the tissue starts to die off, it's going to cause this process called necrosis. So I took it away so you could come back to it again. But necrosis, once again, means tissue death. Yeah, that was the foot. The heel, yeah, to be more precise, yeah. And lastly here is a tattoo, okay? So when we think about a tattoo, it's a needle that's going to put ink in your skin, okay? And let's think of which layer of the skin are we thinking about that's going to be applied here. Will it be the epidermis? Will it be the dermis? Or is it going to be underneath the skin called the hypodermis? Which layer are we putting the ink in for these tattoos? Oh, so some people saying epidermis, some people saying dermis, some people are saying hypodermis. If you put in a hypodermis, it's unlikely because that's where a lot of fat tissue is located at and whatnot. Why isn't it the epidermis though? Why isn't it the epidermis? Why is it not the epidermis? Yeah, because we constantly shed the epidermis, right? It's constantly undergoing mitosis, getting rid of the dead cells and whatnot. So tattoos actually occur on the dermis of the skin so that it remains there for a longer period of time. All right, so hypodermis, once again, is not part of the skin. It's underneath the skin. It's made of areolar connective tissue, yes, but it's also made of mostly adipose connective tissue. And adipose connective tissue helps insulate things, helps cushion our organs. In this case, it does provide a small cushion, especially if we're talking like our buttocks and stuff like that. And it's also a source of energy storage for the triglycerides that are there. And as you can see from this picture, the epidermis is down here on the bottom. And sometimes you've heard of a hypodermic needle, right? Hypodermic needles can potentially be used to inject into the hypodermis. Why inject in the hypodermis? Because it is highly vascularized so that it could get into our bloodstream a lot quicker. Okay, so there is one more structure here. It's called the laminar or Pacinian corpuscle. The Pacinian corpuscles are laminar corpuscles. These are for deep pressure sensation. So if you're leaning against someone or if someone's pressing against you, it's going to activate this laminar or Pacinian corpuscle. All right, let's go on further and start looking at these accessory organs here. Let's look at the hair first. So hair is made out of keratinized cells, and they come from a hair follicle. Once again, it's located in a lot of locations, but there's certain locations that doesn't have hair. Things like the location with thick skin, right? Palms of our hands, the soles of our feet don't have hair to them. Our lips doesn't have hair because of how thin it is. Our eyelids don't have hair. The nipples don't have hair as well. You might be thinking, but I'm pretty sure I saw some hairy nipples before or whatnot. Technically, you didn't. What you saw the hair is around the nipple itself. Around the nipple is called the areola. The darkened, pigmented area around the nipple is the areola. And that's where hair can grow on, but not on the nipple itself. The umbilicus doesn't have hair. Certain parts of the external genitalia doesn't either. And if you take a look at the distal 1/3 portions of your digits, right next to where the nail is at, there is no hair located there as well. Okay? Maybe on the other parts of your fingers, yeah, but not on the distal part. And yeah, that's a pretty scary picture of Gaston, but let's continue on and talk about the hair functions now. And one of them is for protection purposes. So yes, hair will protect us from sunlight if we're talking about hair on our head, right? It's going to also protect things from going into our nose. So the nostril hairs will prevent prevent dust and particles from going into our nose. Same thing as if we're talking about the ears. If we're talking about like our eyelashes or our eyebrows, it will prevent things from entering our eyes, whether it's dust particles or sweat and things like that. It helps us retain heat as well. For those of you who have ever shaved your head, you'll notice that after shaving your head, it's a lot cooler. And the reason why is because the hair kind of retains the heat. And hence why, as babies and stuff like that, they sometimes will wear, or you'll give them something to wear because their head is so big and they lose a lot of heat through their head. And so and they don't have that much hair as well. So you end up giving them a little something to wear on their head. It's also help us with facial expressions, especially when we're talking about eyebrows. And it provides the sensations as well. So there are these receptors on our hair that will detect the movement of our hair. So something like an ant crawling on your skin, you may not actually feel the ant because they're so light. So the touch receptors don't feel the ant, but the ant itself may bump into a hair or two, and by bumping into that hair, that provides us the sensation that something's crawling on our skin. All right, let's take a look at the hair zones. Okay. The hair bulb is the deepest portion of the hair, and this is where it contains living cells to it. Okay. The rest of I forgot to mention the hair papilla. It's just this part here. Okay, the hair papilla is where it's supplied by blood vessels. The hair root is any part of the hair that's beneath the skin. That's not the hair bulb. Okay. Anything above the skin, now we're going to be calling it the hair shaft. Okay. So that's the difference between the three regions. The hair bulb is the deepest part with the hair papilla. The rest of it that's underneath the skin is the hair root. Anything above the skin, hair shaft. There are different layers of the hair as well. The deepest of the layers is the medulla. And this term here, we're going to be revisiting so often. Okay, the medulla is the deepest part of a particular organ. As we expand from there, there's the cortex. The cortex surrounds the medulla here. And this is also another term I will revisit as well. It's just the outer portions of that organ. Okay, they both have these keratinized cells. The medulla has this growing matrix, so this is where it starts to grow or undergo mitosis and stuff. And then we have the cuticle. The cuticle is this very outer portion of it where you end up having, oops, sorry, not that part, but this white part here. This white part that surrounds it. And it's just this layer of cells. You can kind of see the cuticles here. Okay? They make these scaly-like structures on the hair. And the cuticles are going to be different when you look at it on animals or when you look at the human hair. You could actually tell the different types of hair because of the cuticle itself. Alright, so let's take a look at the hair follicle now. So the hair follicle surrounds the hair itself. We have the hair matrix, like we said earlier on, that undergoes mitosis, right? Kind of part of the medulla as well. And it's going to deposit this keratin and melanin in the hair, so it's going to end up making the hair color itself. Then we have this root hair plexus that surrounds the follicle itself, and this is the structure that I was telling you. If something's crawling on your skin and bumps into the hair, it's going to trigger this root hair plexus that's going to detect hair movement. Okay, so the hair itself, once again, is from here to here, and the rest of this is the hair follicle that surrounds it. Next is the erector pilus. Okay, the erector pilus is a muscle. It's a smooth muscle, and this smooth muscle is located over here, and it's going to connect the hair follicle to the skin here. And what happens is during the sympathetic nervous system is also known as the fight or flight system. So whenever we get scared or become nervous or something like that, this is going to be activated. And what happens is it's going to cause the erector pili muscles to contract to cause our hair to stand on itself. By doing that, we will look a little bit bigger than we normally are to try to scare off whatever's threatening us. Of course, for human, we don't have that many hair, so it's not going to do that much to us. But when we do get scared, we do have goosebumps, right? And that's what's causing the goosebumps. At the same time, at cold temperatures, the erector pili muscles are going to be activated as well. Evolutionarily, once again, it activates so that it could trap warm air so that it provides a warmer temperature for the animal. But for us, it doesn't really provide that much of that type of protection. All right, so this is a model that we will see in lab, and we could actually see a lot of these different structures, okay? So first off, you should be able to tell me, if I were to label it from here to here, what is this layer called? I'm not saying tissue, I'm talking about the layer. What is the layer called over here? Very good. This is going to be the epidermis. Okay. If I were to point to this here, what is this layer over here? Very good. This is the dermis. And we go deeper down. What is this layer down here? Okay, hypodermis. Is it part of the skin though? No, it's not part of the skin. Good. All right, let's look at some of these other structures now. Okay, we could see here. What is this region of the hair? Okay, so what is this region here called? Very good. This is the hair shaft. How about this region here of the hair? What is this region of the hair? Yeah, that would be the hair root. Hair root. I saw some people putting hair follicle. Just be careful because hair follicle is this purple structure that you see that surrounds it. And remember, my question is the region. What is this region of the hair over here? So that would be the hair root. What is this region of the hair from here to here, down here? That will be the hair bulb. Hair bulb, very good. Okay. So this purple structure, what is this purple structure called? I kind of mentioned it from here as well. If I were to point to the purple structure on this as well, same thing. This is going to be the hair follicle. Okay. What are these structures here? You notice that they're found in the papilla of the dermis. They're also for the sense of light touch. No. It is a mechanoreceptor, you're absolutely right, but we gotta be a little bit more specific. What kind of mechanoreceptor is this? This is called the tactile corpuscle. Okay, or tactile, or Meissner corpuscle. Either one is fine. How about if we go down deeper in? This is for deep pressure down here. This is the lamellar corpuscle, also known as the Pacinian corpuscle. So either one is fine. How about this red structure over here? Let me use a different pen. What is this structure right there? This is the one that allows our, this is going to be the erector pili. That helps us cause our hair to stand on its end and everything. Good. All right. Let's go on and start looking at these other accessory organs. Nails. They're from the stratum corneum. Okay, so these are all dead cells. Okay, and they serve as a way to use as a tool kind of thing. So we could help us to pick up things that are small. And it also helps protect the dorsal side of our digits as well. All right, let's take a look at these glands now. Okay, so there's two types of glands. Multiple types of glands, but we'll go into each type in just a second. One is for watery secretions. So both apocrine and eccrine are going to be producing watery secretions. And then we have something called sebaceous gland that's going to be producing the oily secretions. I don't know if you remember, but in chapter, was it in chapter, the first chapter? Oh, we'll get into it, but they have...
Hey!
Hello! How's it going? Anyways, so we will be looking at these different types of glands next. Okay, so two types of sweat glands here. We have the merocrine glands and the apocrine glands. Okay. The merocrine are also known as the eccrine glands, so I'll be using them interchangeably. And these glands are the typical sweat glands that we think about. Okay. So merocrine and apocrine. So with the merocrine glands here are the ones that we say we typically think about, and they're all over our bodies. So this is utilized so when we sweat, it evaporates, so it cools down our body. Yes, it does excrete some waste products with it, but not that much compared to our urine. Do you remember what was that waste product called again? Anybody remember what was that waste? Yeah, it was urea. Very good. Awesome. All right. So these sweat glands, they end up going to the surface of the skin. They do that by using something called the sweat gland duct. Okay. The sweat gland duct leads the sweat to the surface of our bodies. Okay. So when we look at this picture here, here's the eccrine gland, and then here's the sweat gland duct here. And then at the very surface here, we have the sweat pores, where the sweat actually comes out from. Apocrine glands, on the other hand, they're only found in certain regions of our body. We'll later learn that the axilla is our armpits. The groin area, also known as the inguinal area, the anal area, and also the areolar area. Remember, areolar is that darker pigmented area around the nipple. These tend to produce a little bit thicker type of substance because of the fatty acids that is produced. And they produce pheromones. And pheromones are these chemicals that's going to affect other organisms within the same species. So this comes into effect a lot with animals, okay? But for humans, we do have pheromones as well for like sexual attraction. But there was a little misnomer where when I was learning physiology and stuff, they were saying how like females when they dorm together, their menstrual cycles starts to sync up. Later on, they realized that study wasn't done correctly, and that new data was formed. So they actually don't sync up. It was kind of like a coincidence that occurred, or the data wasn't accurate. Anyways, the reason why we have the body odor that occurs is because of the bacteria that's on our body. They eat up this fatty acids, and when they eat it up as a source of nutrients, they end up having odor that it produces. Unlike the ducts that of the eccrine glands, the eccrine gland goes straight to the surface of the skin. These ducts go to the hair follicles. Okay, so it's a little bit different. Sebaceous glands, they're the holocrine glands. Remember how we said the holocrine glands, they have their cells disintegrate, right? When the cells disintegrate, they have a lot of phospholipids in there, and makes it a lot more thicker as well as oilier. Okay, this has their ducts going to hair follicles as well. And the reason why it goes to this hair follicle because it produces this thing called sebum. And this sebum is very oily because once again it's disintegration of the cells, so a lot of phospholipids in here. And this helps moisturizes our skin and also conditions the hair. So it prevents us from drying out. So here's the sebaceous gland here, and the sebaceous glands you can kind of see right next to a hair follicle. Like I said, it empties out into the hair follicle, similar to the apocrine glands. And the reason why we get acne, and we mentioned this earlier on, is because these ducts gets covered up by either dead skin, dirt, or whatever. And once it gets covered up, then the sebum gets eaten by the bacteria there. It may end up causing infection, and that ends up causing the acne to occur. Is that why you exfoliate? That's why some people exfoliate. Exfoliation is you're rubbing your skin to end up causing that dead cells on their epidermis to slough off kind of thing. Alright, so here's a histology of our skin. If you take a look at this, you should be able to identify some of these structures and whatnot, and regions, okay? So, you could tell here, this is the epidermis, right? Because that was that keratinized stratified squamous epithelium. We have the papillary layer there of the dermis, and then we have the rest of it, the reticular layer of the dermis, right? Made up of that dense irregular connective tissue, while the papillary layer only has the areolar connective tissue. But the reason why I bring this up is because a few things. One is you could see these glands here. And these glands here, you don't actually see the duct, but these do have ducts that's going to go to the surface of the skin. So what glands are these then called? They're not the sebaceous glands. The sebaceous glands will end up going to the hair follicle. Which one goes straight to the surface of the skin to cause evaporation, to cool it down, to cool our body temperature down? No. These are the eccrine or merocrine sweat glands. Eccrine sweat glands. Good. Okay. However, these glands here, what are these glands called? See how it's going straight to the hair follicles here? These are the, that's the sebaceous glands. There are other glands as well. One is the ceremunous glands. And the ceremunous glands, they're located in the ear canal. Okay, so they produce something called cerumen. Okay, cerumen is sebum mixed with dead cells. And the reason why we have the sebum mixed with dead cell, the cerumen, is to allow the eardrum to be a little bit moisturized so it doesn't get too much dry. So it helps waterproof it helps not cause the eardrum to dry off. But at the same time, it helps waterproof the area because it's cerumen, it's sebum, which is oilier. It also prevents bacteria from growing there. It helps prevent insects from coming in and other objects as well. Mammary glands, on the other hand, are these structures here. And they're found in both male and female as well. But in the females, it tends to develop and produce milk. And when it produces milk, the milk will get ejected out through these ducts here, through the nipple. And it is a special type of apocrine sweat gland. Okay. During pregnancy and during lactation is when it becomes more active. Alright, so that is it for this particular chapter here. What I want to do next is kind of show you some slides so we could be able to look at different types of histology to prepare for our Unit 1 lab quiz. And I know we won't be able to finish, but we're going to continue on next week to look at these slides. Sharon, it will be on the first module. The first module is has a link that says lecture videos. Oh, really? You don't have them there? Let me take a look at that. Are you talking about the last few slides there? You don't have? Let me take a look and see. Okay. All right. If you don't have them, don't worry about it. It won't be on the unit exam. Just use that as a FYI type of thing. Okay, don't worry about it. Okay. All right. Are these pictures? Oh, yeah. It'll be random. It won't be exactly these ones. So you want to look at. So how do you study for this? One thing, you could go on the Weebly site and look at those pictures. You could look at your textbook in those pictures. You could also Google these, okay? And ideally what you want to do is form study groups together. And what you want to do is maybe send out one to your group partner, and then you send one out and say, hey, identify this tissue, and then identify this organ. And they will send out back to you, okay, this is this tissue, this is from this organ. And do that several times, and you'll become more and more familiar with these different tissues. For now, it might seem like, oh, all these look the same, and I can't tell them apart. But the more that you get exposed to this, the more you find the subtle differences, and you'll be able to figure it out. Just like the example I give is like identical twins, right? If you, in passing, and you see identical twins, you might not be able to recognize them apart. But as you get to know them a bit more and more, you get to actually see the nuances between the two, and you should be able to tell them apart. Same thing as with these tissues as well. How would waitlisted access quizzes? You won't have the actual official quizzes until you are enrolled. So we have the quizzes on the third week of class, basically. Okay. We'll talk. EPU, I'll talk after class for those that are waitlisted and stuff. Okay, so let's take a look at this. If you look at this here, I'm going to point to something here, and you gotta tell me what type of tissue is this. Okay, I'm going to point right here. Can you tell me what tissue is this that I'm pointing to here? Are the first two PowerPoints to be on the test? The first two PowerPoints and also the third one. There's going to be a third one that we're going to be looking at tomorrow during lecture. Will the practice portfolio quiz be posted? I will post it soon enough. I may end up extending the deadline though, so it might not be due this Sunday, but I'll probably make it due sometime next week or something. I'll be posting it soon though. Okay. All right, so some of you have said that, only a couple of you, this is simple squamous epithelium, and you are correct. The reason, let's take a look at this, right? Don't forget that I did give out this little flow chart as well to help you identify these things. So if you were to take the flow chart, it will help you look at these as well. And here is if I could find the flow chart here. So it looks like something like this, right? These are all generalizations, so take this with a grain of salt for some of them. So the very first question here, if you take a look, is the tissue next to a lumen? Okay, and if you take a look at this, yeah, we do see a lumen here, right? Here's the lumen right over here. Here's the lumen. Okay, so and then you'll be asking different questions. Okay, if there is a lumen, most likely this is going to be a epithelial tissue. And since this is an epithelial tissue, now we got to figure out certain aspects of it. How many layers is this? Well, take a look at this. How many layers is this epithelial tissue? It's just one layer. Okay, so your next question is, what is the shape of these cells here? And they look pretty flat, to me at least. So that's going to tell you, okay, now I know this is a simple squamous epithelial tissue. Okay. And then my next question is, identify an organ that has this tissue. Identify an organ that has this tissue. Yeah, lungs would be good, even though this is not from the lungs, but I'll accept lungs for now because we haven't gotten to there yet. Lungs will be good. This is actually from the kidney, so that would be an awesome answer too. Where else? Name a couple more. Remember when we talked about, yeah, what type of blood vessels? That one we want to be a little bit more specific. What type of blood vessels will we actually see the simple squamous epithelium? It's the capillaries. Capillaries will actually see it more so than the arteries and veins. Yeah, the arteries and veins will have the tunica intima that has it, and that's fine too. But the one that we will associate it with most is going to be the capillaries because it's made up of only that with some areolar connective tissue. Good. Okay. And so that's what you're going to be expected on the lab quiz 1, right? Lab quiz 1, I'll be pointing out to different tissues, and you're going to explain what that tissue is, or what is that tissue, and where do you see it from? What organ will you see it from? A general chart to use, yeah, it's a general chart to use to identify these structures and stuff, these tissues. Okay, let's, I don't know if we have time, but let's go ahead and just look at one additional one for right now. It's the same, notice how I'm going to be using the same exact picture here, but I'm just going to be pointing to something else, okay? What if I point to this over here, and I said identify this tissue? The first question is, do you see a lumen here? Okay. And if you take a look, here's the lumen here. Okay, now that we see that there is a lumen here, how many layers of cells do we see here? Okay, of course I'm making it a little bit obvious like this. You don't see one layer here. So we know it's simple. Okay, what's the shape of this here? And you notice that the shape is kind of pretty as tall as it is wide kind of thing, so it's going to be cuboidal epithelium. Make sure you say epithelium or epithelial tissue, one or the other. Okay, you don't want to just put epithelial and not put tissue next to it. All right, so what organ do we see this from? Besides, well, we know already what is this picture of, right? Yeah, we find it in the thyroid, very good. And this picture is of the kidney, so we can find it in the kidneys as well. Good, good, good. Okay. All right, so before you leave today, there is a little exit thing for you to fill out. And I'm going to link it for everyone to fill out. Okay, give me a second. Make sure you do this because this is how I'm going to be doing like attendance and stuff. I'm going to randomly do these surveys to make sure that you're here. Okay, so go to this Google form and fill it out. And, oops, that's not everyone. Fill that out, and then when you're done, you can leave. For those of you who are waitlisted and trying to add